Good afternoon, everyone. First, I want to thank the women and men of the Columbus Division of Fire for the work they do every day in this community. Just a few weeks ago, when the tornado and strong winds hit the city, they, for the first time in CFD history, deployed every available emergency vehicle in the city at the same time to respond to the hundreds of 911 calls that came in. We appreciate the ways that you show up for the residents of this city, both on extraordinary days and on the more ordinary days, like when someone has a toothache, which is actually what we're here to discuss. Today, I'm excited to officially launch a new service that will help us provide better, more personalized care to our residents while strengthening Columbus's emergency response system. It's called the Nurse Health Care Navigation Line, and it's another way Columbus is staying on the leading edge of alternative responses and finding smarter ways to meet the needs of our residents. But before I explain how it works, I want to make one thing very clear. If you need help, call 911. That does not change. If you're experiencing a medical emergency, we will send emergency medical help. Our firefighters and paramedics will continue to respond when they are needed. What we're adding today is another option for those situations when someone needs medical help, but an ambulance or a trip to the emergency room may not be the care that's actually needed. We know people sometimes call 911 because they simply don't know where else to turn. And the numbers tell that story. In 2024, Columbus Fire responded to nearly 145,000 EMS calls. In 65% of those calls, no EMS treatment was ultimately provided at the scene. And of the patients who did receive treatment, only 55% of those folks were transported to an emergency department. Those calls are important. Those residents still need help, but we have an opportunity to provide some of them with a different kind of help. That's where the nurse healthcare navigation line comes in. When you call 911 with a medical concern, you will still speak with one of our trained 911 call takers. They will continue to use established medical protocols to determine what kind of a response you need. If it's an emergency, we'll send emergency medical help. But if your situation meets specific clinical criteria, you may now be connected directly with a nurse. That nurse can talk with you about what's going on, assess your needs, and help connect you with the care that makes the most sense for you. That could be an urgent care center or primary care provider. It could be a telehealth appointment, pharmacy services, behavioral health, or substance use support, transportation assistance, or even guidance on safety caring for yourself at home. And I want to emphasize this again. If at any point that nurse determines you need emergency medical care, an EMS response will be initiated. Your safety comes first. But we're now able to offer you another level of care for situations that aren't emergencies. It means a person who needs medical help can be connected with a trained medical professional who can help determine the best places for them to receive that care. There's another important benefit here. When we can safely connect someone with appropriate care without sending an ambulance, we help keep our firefighters, paramedics, and emergency vehicles available to respond to heart attacks, strokes, serious crashes, fires, and other emergency where every second matters. That's good for the individual patient, and it makes our entire emergency response system stronger for everyone else in the community. It can also make a real difference for families when it comes to affordability. We hear every day about the pressures people are facing from the cost of everything: housing, groceries, transportation, and healthcare. An emergency room is absolutely where you should be when you need emergency care. But when you don't, we want to help connect you with a safe, appropriate alternative that may save you time, stress, and expense. Over the last month, we've tested the system with a soft launch period, and we're already seeing promising results. Dr. Lowe will share some of those numbers with you in a moment. I want to thank everyone who helped get us here, including our firefighters and paramedics, the Department of Public Safety, and everyone who helped build and implement this program. Most importantly, I want our residents to remember one simple message. If you need help, call 911. We'll take it from there. Our goal is simple: to get you the right care at the right time while making sure our emergency resources are ready when our community needs them most. And now, I'm pleased to introduce the CFD Medical Director, Dr. Robert Lowe. Dr. Lowe.
Well, good morning. I wanted to start with a real-world example that happened on our very first 911 call that we connected to the nurse line. An adult patient called 911 with concerns for a spider bite, and after a brief triage, the caller was connected to the nurse line. The patient's needs were met without the need for an ambulance to be dispatched. The ambulance from the closest station to that caller remained in service and available. In a very short amount of time later, that very ambulance was dispatched to a 70-year-old who had passed out. This highlights the goals of our program: to do the right thing for the patient at the time of their 911 call. Both patients in this example had their care optimized by this process. Patient number 2 received an ambulance from the closest fire station that was in service and available for a potentially critical assessment and care. Patient number 1 was able to connect with appropriate medical management without larger expenses of the emergency department evaluation and to receive timely care. You will hear us repeatedly say our goal is to match appropriate resources to the patients in the time frame they are needed. The nurse referral line is our latest tool in that ability to provide the right care to each of our patients when they call. Many of you may remember the launch of the Right Response Unit in 2021. That program has maintained its success in routing mental health care runs coming to Columbus Police to align patients with needs with mental health care resources or responses in the most appropriate manner. The nurse line allows us to effectively expand the types of medical needs that can be taken advantage of by aligning appropriate resources for patients calling 911 and for the next patient that may be calling 911. As you heard, in July we did a soft launch of the nurse line. In the first 30 days, we connected 131 911 callers to the nurse referral line. For those callers who engaged with the nurse line, greater than 50% had their medical needs addressed without an ambulance transport to the emergency department. Most importantly, those that did end up needing transport to an ambulance, there were no delayed outcomes. Or said differently, we were able to successfully identify and route time-critical calls versus regular EMS or less time-critical calls. In translation, as you heard, the heart attacks, the strokes, the cardiac arrest, the patients in labor, all of those were immediately prioritized and received an immediate dispatch. We successfully demonstrated that ability to put folks down the correct pathway to manage their medical situation at the time. In addition, follow-up calls with those connected to the nurse line has revealed an extremely positive patient satisfaction set of scores so far. And I should highlight that every patient that's transferred to that nurse line receives an attempted callback within 24 hours to check on both their care and their satisfaction with the process. We are extremely pleased and encouraged by these early results. And as we now move to a full launch of this important program, we continue to monitor the process for safety, for appropriate care, and for satisfaction. We look to refine and expand the resources available to our patients as we continue to grow and mature our EMS system. And with that, I'd like to welcome Councilmember Remy.
Good afternoon. I want to thank the mayor, Dr. Lowe, and Chief Ball, and all of the leadership team here, Director Prashadi. Thank you for everyone who has helped move this work from idea to now something that serves the residents of Columbus. Earlier this year, we talked about a simple goal. When someone calls 911 for help, we should answer that call the right way every single time. That has been the commitment of council as well, building a public safety system that sends the right response to the right call, while keeping our emergency resources ready for the moments that are needed the most. We have now moved into the soft launch of the nurse healthcare navigation line, and I'm very pleased by what we're seeing so far. You heard Dr. Lowe mention some of those statistics, and it's very encouraging about what is next with this program. This is about meeting people with the care that they actually need in the moment. For a true emergency, there should be no hesitation. Call 911. Our firefighters and paramedics will be there to respond, but not every medical call requires an ambulance or a trip to the emergency room. When it is safe and appropriate, connecting a resident with a registered nurse can provide another path to the right care. That makes Columbus safer in two ways. It helps residents get care that better fits their needs, and it protects our vital emergency services and resources so they are available when someone's life truly depends on them. I'm excited for this forthcoming launch and the direction this program is headed. This is a smarter, more responsive public safety system, one that treats residents with dignity while keeping Columbus ready for the moments when seconds matter most. Our responsibility is simple. Answer every call, the right way every single time. Thank you very much. And I'll ask the mayor to come back up.
Appreciate you. Thank you, Council Member. I want to point out this program builds on something Columbus has already demonstrated through efforts like our Right Response Unit. Not every call requires the same type of response. Our responsibility is to listen to what our residents need and send the right response with the right resources at the right time. Columbus has been willing to rethink the traditional model, build partnerships, and find new ways to serve people better. And with the launch of the Nurse Health Care Navigation Line, we're continuing to lead. That is the future of public safety and emergency response. I also would like to thank Local 67, the IAFF, for their partnership and cooperation and support of this effort, because they know it's going to make a difference in the lives of the people we serve. So with that, be happy to take any questions from the press about today's topic or other things on your mind.
Do they want to call the nurse line directly, or do they have to go through a 911 operator?
Typically, that will route through 911, but they are able to request the nurse line. After a period of time, if they've had specific care plans developed, there may be an option to directly contact.
Who are the nurses answering these calls? Are they employed by the city? Is this a contract the city has with another medical company?
Yes, we've contracted with an outside provider. So Crosswalk Health is the entity that is employing the providers, and they have a call center that we connect with. So.
Follow up to that, are they local? How do they know when they're on the phone like what's going to be best, where exactly to send a patient who's calling?
So fantastic question. Their call center is not local. However, we work diligently with those protocols. In fact, Columbus Fire has the final oversight on what those resources are that they connect with. Us working with our hospital partners, our local community partners have identified resources, and we will continue to identify resources that are appropriate for our callers' needs. So ultimately, we control or we provide those local community resources, and we adapt them constantly as it's changing in our community to make sure folks are getting aligned.
The contract is assigned to the
I need to double check. I honestly do not recall if it's 1 or 2 years. I apologize.
And where that funding's coming from?
So the contract is a teamed contract approach. One of the advantages for Crosswalk is that they are able to leverage payers to avoid, to align resources that also align with the payers' incentives to get folks to the right care without an overburden of costs. So there is not an upfront expense that we have paid to Crosswalk. There is some expense in standing up the program and setting up our own local protocols and resources that we've set up with our dispatch software to make that happen.
There is a representative from Crosswalk. I'll put him on the spot behind you guys. So if you want to talk a little bit more about what cities they're working in and some of the results they've seen, you can feel free to talk with him. Any other questions on today's announcement or other things?
Ultimately, it's the dispatcher who is the one who decides whether or not that call can be handled by them or should go to the nurse line.
Yes.
Ultimately, they are making that clinical decision based on the protocols we put in place in dispatch. Yes.
And are there other cities that have done this that you got the idea from? I guess, how did Columbus end up choosing this idea?
Yeah, I think it's something Councilmember Remy and I have been talking about for a while, but we really wanted to make sure that we did this right and based on best practices. And there were other cities that I think Crosswalk and others had been working with, but Dr. Lowe might have some of those other cities.
Yeah, there are folks who have done similar programs both with Crosswalk by themselves or with other vendors. We've had discussions, obviously, with them to kind of learn from a collective experience. I think the folks we probably spent the most time talking were with Washington, D.C. and Indianapolis.
It's transferred to the nurse helpline. We have the option to opt for ambulance instead.
Yeah, the caller has the option to opt back, absolutely. And if callers are disconnected in any way, they will be recontacted back to make sure that there wasn't an accidental drop.
Mayor, if I may go off topic, what is your reaction to the 6-year-old girl having been shot over the weekend?
Well, I'm not the mayor, just the mayor. I'm a dad, and anytime anybody in our community is injured, but particularly our young people, I'm saddened, I'm angered, I'm frustrated. We need parents to step up and make sure that firearms are locked up and out of the hands and access of young people. We have gun locks available at Columbus Public Health, and we need everybody else to step up and do their part. There's not a whole lot of detail I can speak to this particular incident and investigation, but this is why having parents do their jobs and make sure that they're keeping firearms out of the hands of children is so important.
We're here from residents along Roberts Road, West Columbus. They've had 2 deadly crashes in that area. They say that the speed limit needs to be dropped. What's your reaction to hearing that there were 2 deadly crashes?
Couldn't agree more, and this is why Vision Zero has been such a high priority for us as a city, working closely with Director Scacco and her team at Public Service. The amount of dangerous crashes and fatalities along Cleveland Avenue in Linden is another area that is of high concern, and so we're going to continue to focus on changing the way our intersections and roadways are set up, taking a look at other ways to control speed. Enforcement is part of that, but also the environment, and trying to make sure that we have protected bike lanes and other things for folks to be able to get around safely on foot or on bike. But it's an issue plaguing cities around the world ever since coming back from COVID, high rates of speed, reckless driving, and it's something we're going to have to continue to work on. But Vision Zero is making a big difference, and we're going to continue to work with neighbors like these that want to look at all options to keep our roadways safer. All ideas are on the table, and we'll be talking with them about that, as well as, this is all about behavior and compliance, right? I mean, we can't have law enforcement out at every intersection, every roadway in the city. And so part of this is raising awareness, educating the public, and helping folks understand the disastrous and tragic consequences of reckless driving and speeding, and the consequences it has for the entire community.
How is the new youth curfew working, and has it helped prevent any crime or shooting so far to your knowledge?
We're blessed that we have an incredible division of police that is focusing a great deal on not just enforcement but engagement, and under the leadership of the chief and her team, this year we are exactly where we were last year, which is the lowest amount of violent crime and homicides in 25 years. That's a testimony to the great work of the Division of Police, and so it's really this continuing this comprehensive approach: prevention, intervention, and enforcement. We're not interested in locking up kids, but we need parents to have a curfew set in their homes as well. And I know we're back at school and students are back in the classroom, but we still, particularly on the weekends, need parents imposing and enforcing a curfew at home. We can't expect the police to raise kids for the community.
Last week you announced changes to how the city's going to be using flock cameras. Can you talk about what led to those changes, and also what you say to community members who say that doesn't go far enough and doesn't want the city to be using them at all?
Well, there are 3 things. This really isn't about any particular company, it's about the technology. And when you talk to officers on the street and ask what has made the biggest difference in this dramatic reduction in crime across the city, the Gun Intelligence Center and the NIBIN tracing, we now can get a trace on a gun in about a day, whereas before it would take 50 to 60 days. The other thing is the non-fatal shooting pilot that we piloted in the Linden area, seen a dramatic reduction, because the non-fatal shooting of today oftentimes becomes the homicide of tomorrow. And we've seen dramatic positive results in Linden, and we're going to be announcing the expansion of that non-fatal shooting pilot. And then the last thing is the use of this technology. We know that it's been used in about 55% of the homicide investigations, holding people accountable, getting dangerous people off the street. We have put in numerous changes and reforms in partnership with the community and the police, and we're looking to do even more. We should not have to choose between privacy and public safety. And so we look forward to continuing to work with council to figure out how can we continue to use this technology that's made a huge difference in the lives of the people of Central Ohio while still protecting privacy.
Curfew is being done to protect the youth in Columbus from being victims of violent crime. What do you have in mind to do with additional safety?
Well, in addition to historic investments that we've made into summer youth programming, the superintendent has asked me, and I view my roles to the superintendent as partner in chief, and one of the places she's really asked for help is for after-school programming for middle schoolers. And this year, we're going to have the largest number of after-school programs for middle schoolers at the direction of the district than we've ever had before. These are great programs that are being run by Big Brothers, Big Sisters, Boys and Girls Clubs, YM, proven great organizations that have proven track records of serving young people. So that's one of the other areas we're focusing on young people is in these after-school programs that will be up and running and pretty robust here in the next 30 days. Thank you, guys. Appreciate it.